Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, welcome back. And during the break, or right before the break, Ray did have another question, and I'm always excited to answer his questions or any of your questions because they're all very good questions. Ray's question was, cancer cells cannot live in an alkaline environment. Can the human body be brought to an alkaline level to kill the cancer? Well, I would probably say if that could have been done, it probably would have already been tried. But I think the body, I mean, you can change the pH slightly, but I don't know how much you can change it. The problem with that, if we get too alkalinic, we basically can destroy all of our cells. So there's some basic uniformity of all cell structure. When they're too acidic, it is as bad as if they're too alkalotic. There are some waters that might raise your pH, but we produce acid as a byproduct of metabolism. So CO2 is really an acid, and it is blown off as CO2, or it is excreted in the urine as bicarbonate. So we basically have two ways to, because the process of being an aerobic organism, which means we're using oxygen, we're basically burning off or making CO2 or making acid as a result of our metabolism. So you'd have to literally kind of shut down your metabolism, which obviously isn't very good either. We have to have two mechanisms. So sometimes when you go into renal failure or you become acidotic, you'll start blowing off more CO2, and there is this acid-base balance that exists between your lung and your kidneys, and they're in charge of maintaining your pH at the right, just slightly acidic, and not too in the alkalitic area. You could actually hyperventilate, which changes your pH. You can hyperventilate to the point where you start to get some numbness and tingling, and that will actually blow off, that will just blow off the CO2, and then that will change your pH. Could you do that forever and a day to kill all the cancers? I doubt it. I mean, it would be very, very difficult. Could you inject something in the blood to change the pH in there? I mean, I don't know. I think the cure for cancer comes in the new direction we're headed, which is in the immunotherapy thing, by developing white blood cells and your antibodies to that particular cancer, as opposed to using chemotherapeutic agents and radiation. They're barbaric. I mean, they're killing good tissue to get rid of bad tissue. It's called chemotherapy, and chemotherapy is a broad term. Chemotherapy is with antibiotics, like we talked about just in the last segment of the show. I give you an antibiotic, I kill the bacteria that may be causing your infection, but I'm also killing a lot of good bacteria, and I'm selecting for resistant organisms. When you give chemotherapy, you kill the cancer cells that you can kill, but you also leave behind the tumor cells that are resistant to that chemotherapy. Same thing is true with some of the HIV drugs today. Some of them are susceptible to the virus, some aren't. Use them in the wrong order, and you preclude the use of another drug that can be used in your armamentarium. So there is a very logical approach to treating that disease. So stimulating your immune system is going to be the best way to kill cancers, and that is developing antigens and things like that nature to come in there to destroy that. And again, part of what this physical, yearly physical we're going to talk about is how do we maybe prevent cancers. And I mean, we can't prevent every cancer. And certainly as our body gets older, we become more susceptible to cancers because our immune system doesn't have those capabilities that we had before. Limiting your exposure to carcinogens is obviously one of those things. Having been dealt a decent genetic deck can help you. But let's talk about maybe one of the few of the cancers that we can screen for. Colon cancer is one of those cancers that's very easy to detect with a colonoscopy. Obviously, it's still a little bit cumbersome to get them done in Pahrump, but they are being done over at the hospital through Dr. Sorensen, assuming you don't have one of the HMOs, which still require those to be done down in Las Vegas. But really, colonoscopies need to be done from age 50 on. They're not as bad as people think, but you just have to drink a lot of fluids in order to clean your colon out so they can see if there's any growths. But all colon cancer comes from polyps. Now, if you are not so, don't have transportation, don't have the ability to go down there, you can use one of these things that we're using in the office. This is basically a colorectal fit kit, and this one is very, very simple to use. It uses an immunochemistry test, so it doesn't really, the old fecal globin test used to be that you basically had to take some stool and smear it on a card, and I mean, really, who wants to mess with that? But this uses an immunochemical card, and it's a lot different in that, and you'll find in the kit that you basically get a couple of brushes in there, and if you read the instructions, they have this nice long brush with a little filament on there. I guess you could use it as a paintbrush if you wanted to, but I would hope you wouldn't do that after you did the test, but I mean, there are people that'll reuse anything. But anyway, that being said, this is what you're going to do, and you're going to, obviously after having a bowel movement, what you're going to do is you're going to actually take the brush and, if my thumb would represent a piece of stool in the toilet, you're actually going to brush the brush against the piece of stool, not getting fecal material, but getting the water next to the stool, and then you're going to peel the card away, this part, and you're going to take the water and you're going to dab it onto this thing, and you're going to close it up, and then you're going to take one of these little labels that you write all your information down on, and you're going to seal it in this little square right here so that it shows that it has been done, and it has your name, date of birth, and then if you have more than one bowel movement in a day, that's fine. You can use the other brush in here to take another sample of another stool bowel movement. Again, getting the water. If you put a lot of stool on here, they'll kick it out. It won't allow you to turn it in. And then getting the water, dabbing the water on here, putting that in again, throwing the thing in there, and then putting this little seal on here in the appropriate area. And now you have this thing which has been completed. It has your name and address. You basically will fill out this insurance information. Now, I believe on Medicare screenings, there's a place to check for Medicare screening on here. That will, most insurance companies as well as Medicare will do these for free for you. To check for colon cancer. So it doesn't cost you any money to do that. You put all your information on there, you fold it up with the card, you place it in the envelope, and you put it in the mail, and you now see your doctor because you're going to put your doctor's name and address on there. This goes to Quest. This one happens to go to Quest, and put it in the mail, and then follow up with your doctor in about 2 weeks to get the results on this. Now, this is a very I think, somewhat clean compared to some of the other ones to do. It gives you a little checklist on the back, and then it gives you a little bag in here for each one of those brushes, so that you can take the brush that you've used, drop it in here and throw it in your trash can. So, and I guess if you wanted to save the bag and use it in the other one, but they obviously don't let you do that. So, but anyway, this is a very effective way of checking for colon cancer. And if you do have it positive, and it does turn up positive for blood, hopefully you will follow up with your doctor so that you can have a discussion on what might have caused the bleeding. But if you tell me you have hemorrhoids, I'm still going to tell you that I don't know what exists above your hemorrhoids, and it could very well be a colon cancer. It could very well be a diverticular disease, or it could be one of the other causes for bleeding. But diverticular disease is a common disorder. It will cause you some discomfort, and unless it becomes severely infected, it may not kill you. And ulcerative colitis or some of the other bowel diseases can very well cause cancer. So this is a very easy way to make sure that you do not have a bleeding area. And all polyps in the colon, if allowed to exist long enough, will turn into cancer. It's not will they, it's when will they. So you snip a polyp, you're going to get a colonoscopy every 3 years. And if you have nothing going on, then you can wait from 7 to 10 years. If you have a strong family history of colon cancer, then you probably want to stick with the every 5-year routine, or 3, depending on what your risk factors are. So I encourage you, as a part of your health screening in this new year, to get into your doctor, discuss the FIT kit or the fecal globin test if you choose not to get a colonoscopy. Very, very useful, easy, simple test to do in the privacy of your own bathroom, and doesn't require medications, drugs, trips to Vegas, and drinking 72 ounces of a lime-like substance with really no fizz or anything else in there, and starving for the night so you can go get your colonoscopy done. And if it turns up positive, unfortunately, you will have to have a colonoscopy. There's no other way to get around that. But certainly if it's negative, it gives you a good opportunity to skip that year and move on to something else. So on the next segments of the show, we'll be talking more about the screening test, mammographies, and PSAs, and other tests that can be used for your wellness exam to assess some risk of cancers. Remember, as a Medicare patient, you have that insurance company for the rest of your life. Medicare can't really control the cost of medicine, but it sure can control maybe the devastating effects of some of the chronic diseases. Again, thank you for tuning in. It's always my pleasure to answer your questions, enjoy the show. Thank you very much, Pahrump. I'm Dr. Reiner. We'll see you next week.